How can a CEA tumor marker test show a false negative? Imagine going for a test to check if cancer is still there, only to find out the results look normal even though you might still have cancer. That's what a false negative in a carcinoembryonic antigen or CEA test means. It happens when the test shows low or normal CEA levels, but cancer is actually present or has come back. Several factors can cause this. First, not all colon cancers produce enough CEA to be detected. Some tumors, especially those that are poorly differentiated or of certain subtypes, may not secrete much CEA at all. This means even if the cancer is there, the blood levels might stay low, leading to a false negative. Well-differentiated tumors tend to produce more CEA, while poorly differentiated ones produce less, which makes the test less reliable for some patients. Another reason is the sensitivity of the test itself. The CEA test has a certain cutoff point, often around 2.5 micrograms per liter. If the CEA level is below that, the test considers it normal. But this cutoff isn't perfect. It can miss about 18% of cancers because the tumor might not produce enough CEA to cross that threshold. Raising the cutoff makes the test more specific but less sensitive, which means more false negatives. So, a normal CEA level doesn't necessarily mean there's no cancer or that it isn't coming back. Timing also plays a role. Early-stage colon cancer or small amounts of residual disease after surgery might not elevate CEA levels enough to be detected. CEA is more likely to be elevated in advanced or metastatic disease. Testing too soon after treatment or when the tumor burden is low can lead to false negatives. Plus, individual differences matter. Some people's bodies clear CEA faster or produce less of it naturally. In rare cases, the body might develop antibodies against CEA, interfering with the test and making the levels appear falsely low. Laboratory factors can also contribute. Variations in how the test is performed, errors in sample handling, or differences in assay methods can affect results. Since CEA is a nonspecific marker, relying on a single test without considering other factors can be misleading. Smoking does raise CEA levels, but it does not cause false negatives. Other health conditions might influence CEA levels, but they usually cause false positives. In the context of colon health and cancer, doctors use the CEA test as part of a bigger picture. It's not a standalone tool. Because false negatives can happen, it's important to combine CEA results with imaging tests, colonoscopies, and clinical exams. A low CEA doesn't mean the cancer is gone. Ongoing monitoring with multiple methods helps catch any recurrence early. If you or someone you know is being tested, remember that individual differences matter. Always discuss test results with a healthcare professional who can interpret them in the full context of your health.